A 62-year-old who retires today and earns just $1 over about $62,600 as a single filer can lose their ACA subsidies entirely, according to 2026 healthcare.gov marketplace rules. That flips their premiums from a few $100s a month to $200 from $800 plus, and almost nobody sees it coming. I read the fine print so you don't have to. Let me show you exactly how this gap works, and why the number that trips people up isn't their savings, it's their income. Here's the simple version. Then I'll immediately complicate it. Medicare, the government health program, doesn't start until you turn 65, but the average American actually retires at 62, according to figures cited by AARP and Bank of America. So there's a 3-year window where your employer coverage is gone and Medicare hasn't kicked in yet. Think of it like a bridge that's out 3 years before you reach it. You either build a temporary crossing or pay a toll every month. The catch is how brutally expensive that toll gets. First mechanism, age rating. Under Affordable Care Act rules, an insurer is allowed to charge someone who's 62 up to 3 times what a 21-year-old pays for the identical plan, according to healthcare.gov's age rating rules. That's why a benchmark silver plan for a 62-year-old commonly lands between $1,000 and $1,800 pluses a month in 2026. Think of it like a teenager's car insurance, just flipped. Here, it's being near retirement age, not being young, that pushes the price to its legal maximum. Second mechanism, the subsidy. Normally, ACA premium tax credits knock those big numbers down. In 2025, the national average premium after help sat around $381 to $507 a month, per marketplace data. So subsidies are the whole reason many people can afford marketplace coverage at all. But here's the trap. Those credits don't taper off gently. Think of it like a discount that disappears the instant your income steps over one painted line on the floor. And in 2026, that line came roaring back. Third mechanism, and this is the one that changed. From 2021 through 2025, enhanced credits remove the old income cliff, but those enhanced credits expired at the end of 2025 and weren't renewed, so for 2026, the 400% federal poverty level cliff returned, roughly $62,600 of income for a single filer, per marketplace guidance. Cross that by a single dollar and you lose every cent of subsidy. Think of it like a game where 400 points wins nothing, but 401 points wins the jackpot. Except here, the jackpot is a bill you pay every month. So people reach for COBRA, the option to keep your workplace plan after you leave. Here's the fine print. COBRA lasts up to 18 months, but you pay 100% of the premium, plus up to a 2% administrative fee, according to AARP and Bank of America. AARP notes some employers pay as much as 80% of the cost while you work. So if you were paying $200 a month on a $1,000 plan, COBRA jumps you to about $1,020. That's roughly 5 times what you were paying. Think of it like keeping your company car after you quit. Same car, but now the whole lease your employer covered lands on you. Let's make this concrete with Lisa, a single 62-year-old project manager retiring on about $70,000 of income. That's just above the $62,600 cliff. So under 2026 marketplace rules, she gets 0 premium tax credits and pays full freight. Her benchmark silver plan runs about $1,500 a month, $18,000 a year, and $54,000 across her 3 years to Medicare. Think of it like tripping a laser alarm by one step. The system doesn't care that she's barely over. It treats her as fully over. If this is useful, subscribe. The next breakdown is already coming. Before I get to the last part, which is the most counterintuitive piece of this whole thing, look at Lisa's COBRA option. Her employer plan cost $1,000 a month in total. She paid $200 while the employer covered $800. Under COBRA, she'd pay $1,020 per AARP's cost structure. So 18 months of COBRA runs about $18,360 versus the $3,600 she paid as an employee. Think of it like your rent tripling the day your roommate moves out. Now here's the part almost nobody plans for at all. Here's the buried detail the brochure never leads with. The National Council on Aging reports couples expect roughly $75,000 for health care across retirement. But Fidelity's 2025 estimate puts the real figure near $330,000 for a couple, more than 4 times higher. For a single 65-year-old like Lisa, Fidelity estimates $172,500 in after-tax savings just for health care. Think of it like packing for a weekend trip and finding out you're actually moving abroad for years. Lisa assumed $75,000. She's under-saving by around $97,500 before a single premium is counted. Stack it all up. If Lisa keeps income under the cliff and goes straight to subsidized coverage at around $450 a month, 3 years costs about $16,200 versus the $45,360 she'd pay through full-price ACA and COBRA. That's roughly $29,000 in avoidable premiums. Add her $97,500 savings shortfall from underestimating lifetime costs, and Lisa is staring at over $125,000 of hidden healthcare risk per Fidelity and Marketplace figures. Think of it like 2 leaks in the same boat, one visible, one below the waterline, both draining the same budget. So what does this mean for you if retirement before 65 is on the table? The lever isn't how much you've saved. It's your taxable income in the years before Medicare. Because subsidies are tied to modified adjusted gross income, drawing more from Roth or cash accounts can keep you under roughly $62,600 and unlock those credits per healthcare.gov guidance. Think of it like a thermostat. You're not spending less. You're controlling which dial the government reads. Done right, premiums can fall toward the $381 to $507 national average instead of full price. The second move is to compare every bridge before you cross one. Pull the full COBRA premium from HR, check a working spouse's plan, and price at least 3 marketplace tiers on healthcare.gov. The default choice is rarely the cheapest, so think of it like checking 3 flights before booking. Then pre-fund the gap. Earmark savings against a target like Fidelity's $172,500 individual estimate. And if you're 55 or older, use the extra $1,000 a year HSA catch-up contribution. Small moves now beat a 6-figure surprise later. The system isn't hiding the rules. It's just betting you won't read them until it's too late to plan. Next, I'm breaking down exactly how HSA catch-up contributions work and how to build a health cost fund before 65. If you want to catch that one, subscribe so you don't miss it.